Children's services have a number of different teams where you may be employed. Across the Southern Trust, there are 5 long-term therapeutic units: Eden Villa in Banbridge, Woodside in Armagh, Cedar Grove in Newry, Beaucombra in Portadown, Cherry Grove in Lurgan. Each of these units can accommodate up to 5 young people aged between 12 and 18 years. A small proportion of the looked after young people are accommodated in residential care. The service offers a specialised therapeutic service to young people who have experienced trauma in their lives and require specialist intervention. In addition to the long-term therapeutic units, the Trust also provides short breaks to children with a disability in residential settings. There are 2 disability short break units, Oaklands in Armagh and Carrickore in Newry. These units provide respite placements for children with disabilities. On the screen are a number of key pieces of legislation relevant to working in residential care. This is not an exhaustive list, and there are many other policies and procedures in place to support the health and well-being of the young people who live in residential care and the staff who work there. It is important to remember that this is the young person's home, and we are coming into their space to work with them. Residential care is a 24-hour service, which is operational 7 days a week. Residential staff work shifts, and this is unit-specific based on the needs of the unit. Staff in residential care are required to work weekend and evening shifts. This gives social workers a unique opportunity to have shared lived experience with the young people they work with and creates opportunity to develop positive relationships. Residential services accommodate young people aged 12 to 18 years with varied lived experiences. Childhood trauma is often a feature of these young people's lives. Residential experience offers a dual care element, providing a safe, caring environment for the young people by doing all that would be expected of a good parent, alongside therapeutic input based on the ARC model of care. The ARC model of care has 3 components: attachment, self-regulation, competency. Attachment. Children in residential care have often had negative experiences in their primary relationships, which has impacted on their ability to trust people. Residential workers use positive relationships with young people to enable them to trust others and themselves. Self-regulation. Through the use of self, residential workers help the young people to manage their emotions and develop self-regulation. Competency is the end goal. The hope is that young people can be helped to integrate the trauma they have faced in their childhood and learn ways to cope in the world and hopefully go on to thrive. Through the use of the various components of the ARC model, residential staff work with the young people through assessment, formulation, to support development of a therapeutic plan. The plan is then implemented with ongoing review to ensure that the young person's overall needs are met. Residential services will, at the right time, support the young person to return home, access foster care, access independent living, but only when the time is right. For more information, please research the following links, which can be found in the accompanying Training Word document.